In today's health alert, residents are being advised to protect themselves from mosquito bites after recent rains. Our chief health editor, Dr. Partha Nandi, joins us now to discuss the mosquito-borne diseases to watch for and the symptoms that are out there. It's that time of year, Doc.
Yeah,
the dog days, as Rex Ross told us.
Exactly, and you and I know, right? Nothing ruins a picnic quite like those pesky, biting mosquitoes. And in June, the Michigan Department of Health and Human Services Bureau of Laboratories confirmed this, that mosquitoes collected in Saginaw County tested positive for Jamestown Canyon virus. Now, this virus is classified as an arbovirus, which stands for arthropod-borne virus. Now, arboviruses are transmitted to humans and animals by arthropods, which is a fancy scientific term we like to use for insects. The Jamestown Canyon virus is spread when mosquitoes feed on infected deer or other animals and then bite humans. Now, most people don't get sick, but symptoms can develop, right? And it can happen within a few days to 2 weeks and may include fever, headache, and fatigue. Now, severe disease affecting the brain or spinal cord can occur, but this is where. As for West Nile, right, we've heard about that. It belongs to a group of viruses called flaviviruses. It's been detected this year in mosquito samples from as close as St. Clair and Kent counties. Now, West Nile is primarily transmitted by mosquitoes. Now, they've bitten infected birds and then bite humans. It's the leading cause of mosquito-borne disease in the U.S. And so far this year, there have been 25 reported cases, but thankfully none in Michigan. Symptoms of West Nile can include fever, headache, body aches, vomiting, diarrhea, or rash.
So are there any vaccines or drugs to treat these mosquito-borne illnesses? And we all could use a reminder of how to protect ourselves and keep ourselves safe.
100%. So to answer your question, Curly, there's no specific drugs or vaccines to prevent or treat mosquito-borne illnesses, Glenda. In humans, so it's important to protect yourself, and here are my recommendations, and I've said this before: use insect repellent, apply repellent with DEET or other EPA-approved products on exposed skin and clothing following the label instructions for safe use. Also, please wear protective clothing when outdoors. Light-colored, long-sleeve shirts, long pants, and socks can help reduce mosquito attraction and bites. And avoid peak mosquito times. Dusk and dawn are when these pesky mosquitoes are most active. And eliminate standing water. Keep mosquitoes out of your home. Make sure that screen windows and doors don't have those holes or tears. And following these steps can really help reduce the risk of mosquito-borne illnesses. And usually it's just a nuisance, but I know there have been patients that have died from some of these diseases. So it's serious, and you want to make sure that you protect yourself as much as you can.
All right, Doc, we appreciate it.
Yeah, I don't want people to have be afraid, but just take precautions.
Yeah, all right. Thanks a lot, Doc.
Well, love that jacket.
Thank you. Appreciate it. And if you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll get it right to him.